Okay, guys, welcome back to number 4. I was having some technical difficulties in 3, and I'm Stacy Hewitt. I'm acupuncturist for 13 years, acupuncture teacher for 7, and we're starting back on the most common clinic presentations or things you're going to see in the clinic. So we're going to continue on to where we left off. Sorry, I was having some technical difficulties, but I figured it out. Let me move this up here. So the next pattern we're going to talk about is depressive heat. So depressive heat basically comes from the liver. If the liver becomes depressed, the chi stagnates. If it becomes frustrated, doesn't mean the person can only be depressed. If they're frustrated, if they have anything else that gunks the liver up, transitions. We've talked about this prior in probably the very first video of this lecture, but any liver chi depressive things, then suddenly the liver gets a little funky, it gets angry, the chi starts to stagnate, and then if the stagnation occurs, then eventually it transforms into pathological heat. Think about energy is yang based, energy has this yang element, right? This heat element. And what happens is the liver is all about distributing the chi smoothly, making sure the chi's running smoothly. That's one of its jobs. And when it's not doing its job, then suddenly this chi starts to bunch up, and you have that yang heat element that's part of chi, and it starts to just get hotter and hotter, and you start to get this what's called depressive heat. It turns into a pathological type of heat. And remember, chi is inherently warm. That's what I was trying to say. Now, this is says it a little more eloquently. And if it becomes stuck and it accumulates, it will transform into what's called depressive heat or transformative heat. So that's what they're talking about when you hear depressive heat. And then, not in this lecture series, but in another lecture series, probably it's like, I think it was Who's on What Team, that lecture series. We talk about transformative heat or depressive heat. We talk about liver heat and all the different things that it attacks because it likes to get hot and then attack other things. So anyway, check that out if you haven't seen that yet. It's a good video. Hold on, let me get these things going. There we go. Depressive heat. For more about depressive heat, over time, this pathological heat, um, being young by nature, warm by nature, it will consume and dry out the kidney yin. That's not the first thing, but it happens. Not happens all the time. This is something that you potentially could see, right? And yin is supposed to control yang or help control that. If the kidney yin becomes deficient, then a weak liver yang may become hyperactive. So basically, as we've talked about before, when the liver is not getting all the yin that it needs to cool down, then it will start to get a little aggressive. And it will generate heat. Heat starts to rise, and then you'll see it pop up in, say, the heart, palpitations, the lungs, having this cough. You'll see that in hepatitis a lot. And then the heat can also rise to headaches, and then you could have some emotional issues because of the heart getting a little hot. Heat can accumulate in the lungs, heart, and the breast tissue. You can start getting some lumps in the breast tissue because of that. Rise through the head. You get some emotional pieces as well. And also, depressive heat can impact other organs. We were talking about how the liver attacks everything all around it. So the spleen can get hit. You start getting diarrhea. Bladder, you start getting UTIs. Large intestine, you start getting constipation, things of that nature. So what can we do about the depressive heat? So liver 3, large intestine 4, Those are some good, that combination, we've talked about it before, can be beneficial to moving energy around and regulating the liver. Also, liver 2 is a good liver point to help control the heat. It's the fire point. Gallbladder, I mean, sorry, governor vessel 20. If the heat's rising up in the head, that's a little, remember, governor vessel 20 sometimes can be considered as like the little chimney. It lets heat out, helps calm the mind. PC6 for fullness in the chest, helps calm the shin. The PC, we haven't talked about that yet, but the PC I think is kind of like um, cooling fins that help the pericardium, helps try to displace heat from get heat away from the heart. Um, Kidney 6 is the kind of quintessential yin point for the kidneys. Kidney 3 also helps regulate the kidney yin. I mean, regulate the kidneys in general. So those could be some good points to work on the mother channel to help further try to generate some water to cool that liver down with. So dampness. It's funny, the last part of this lecture is all about dampness and phlegm, and it seems like it goes on and on and on, and it feels like this damp stuff that slows you down. But anyway, dampness, that it refers to excess moisture or fluid causing stagnation, heaviness, and discomfort. We've talked about this before, where this fluid will make your limbs feel heavy, it'll make people feel lethargic, make their mental processes seem a little lethargic. If you need more information about, well, here's some symptoms here, but we go into that a lot more in the previous lecture series that I had. Who's on, or not who's on, yeah, who's on what team. So check that out. I mean, it's really great stuff. Dampness, some of the symptoms of dampness include bloating, sluggishness, watery stools because of the excess water in the system. Also, it's like, think of the spleen is not able to transform fluids or dampness because it's overwhelmed, it's weak. So that's when you start seeing some of this diarrhea. Heaviness of the limbs, fatigue. We've talked about fatigue earlier in this lecture series, mucus, and then sluggish, cloudy thinking. So here's some points or some ways to look at how to treat dampness. Spleen 6, stomach 36, CV12, all of that is trying to help that earth phase, strengthen the spleen to help it get back to transforming and transporting dampness, moving fluids around the body and transforming that fluid into stuff that the body, basically it's like a bilge pump is trying to move that fluid out and around. It's trying to move it through the body and transform it into something productive, some kind of nutritive force or organic fluid, not just some kind of dampness that's hanging around. Bladder 20, bladder 21, stomach shoes, bladder 21, bladder 20 is the spleen shoe. If you're seeing some dampness, if you do moxa, a little moxa on that will help. It's really trying to enliven the yang components of that yin organ to try to get it to function better. Bladder 22 is the Sanjiao shoe. That can also help with some fluid fluids that are stuck. It can assist with the process of trying to move the fluids around. Spleen 5, spleen 9, both are good points for working with dampness, as well as CV9. They're all dampness clearing points. GV34 and liver 3 are a good combination, especially when you're starting to see accumulation in the abdomen area. Qi accumulation, also fluid accumulation. It helps move that out. Next thing is phlegm. Phlegm is a more thick version of dampness. It's when dampness has become stagnant for a period of time, then it starts to become more substantial. So thick pathological accumulations of fluids causing blockages and dysfunctions of the chi and blood in the channels. Because when the phlegm gets in the way, then chi will start to stagnate, blood will start to stagnate. Sometimes you'll see this. We've talked about this in the last lecture series. Sometimes when you look at diagnoses for stroke, they talk about phlegm being in the channel, blocking the chi, moving it around. Phlegm symptoms. Diffuse phlegm coming from any orifices or orifice, just kind of, it's just nose, mouth. I guess you can have mucus in the stool as well. Plum pit chi, they'll talk about that, that feeling or that sensation of feeling like there's something stuck in your throat. That also can be a liver chi stagnation sign as well, but it can also be phlegm in the throat. Phlegm nodules, obesity, oily skin, heavy acne. You know, with obesity, it's not just going to be like, oh, this phlegm is going on. Check it with people what their lifestyle is like, what their eating habits are like, how much exercise do they get. I have this in another lecture coming up about, patients quite often would ask, "What does acupuncture help with weight loss?" And when I was a young buck and all of this, I'd be like, "Sure, acupuncture helps with weight loss," because I was excited about acupuncture and everything was magical then, and I hadn't treated as many people as I have, and acupuncture will help with weight loss in a certain extent. It's like, when people have a really bad diet and haven't been exercising, then the spleen, the earth phase will be weak, because they're eating a bunch of French fries and ho-hos, and they're not doing anything about working out to get the body to the energy moving and things working better. And so, sure, acupuncture can help repair some of that damage, but there's no magic point for people losing weight. It's not like you stick a needle in there and suddenly they deflate. And that's what most people think is going to happen when you tell them that acupuncture helps with weight loss. Sure, you can do some of the ear points to try to help with cravings and things like that, but really it's a matter of what you eat, how much you eat, and how much you exercise. Those are the big heavy hitters when you're looking at weight loss. Sure, there's some metabolism issues that maybe acupuncture can help with, but it's really those three factors. Acupuncture alone is not going to make somebody lose weight. I'm sorry, guys. It's just the truth. And there's books about. I bought a book that was like TCM and weight loss, and I was like, oh, I know how to make people lose weight now. They've got to work out and they've got to eat well if they really want to lose weight. There's nothing magic. There's no magic involved with losing weight. But anyway, that's not what this is about. I'm sorry to digress. Sorry about that. Lack of mental clarity. Maybe that's what's happening to me right now. Lack of mental clarity. That's a big thing with phlegm and phlegm symptoms. More extreme psychological issues. I gave an example in the last lecture series about a guy that I ran into in New York that was like, phlegm. This is just what they're talking about. Phlegm coming from every orifice. And the guy was just shaking and he was all crazy and yelling at folks. That's what they're talking about with this. I mean, sure, we get when they're what they're talking about with more extreme psychological issues. When what I was doing with the cough is, sure, if you get phlegm in the lungs, you'll get the cough. But when they're talking about more extreme psychological issues, that's what they were talking about. Phlegm's coming out of everywhere. People are just shaking because they're crazy. I mean, that's what they're talking about. It's not like, oh, I'm a little mad. It's like that kind of stuff. So what are we going to do about this phlegm? Look at the points that we just looked at for dampness, because those are some of the same points that you're going to use, because phlegm is the child of dampness. It's what dampness turns into. Stomach 40 is a really great point. That's the quintessential phlegm point on the stomach channel. Sometimes you can look at lung 7, lung 5, bladder 13 if there's phlegm in the lungs. PC6, once again, we talked about that chest. If there's fullness in the chest, phlegm in the chest. So those are some points for that. Damp heat. Damp heat uh, combines excess moisture, that dampness again, and internal heat. Oh my gosh. So you got two things going on. So it can also be causing inflammation, redness, and discomfort. Damp heat is caused by improper diet, emotional stress. Guess what? Because of that depressive heat that we were talking about earlier. So the liver can be involved or infections. So that's another thing too, leading to internal moisture and heat accumulation. So improper diet, you're eating too many ho-hos, and that's making your spleen not able to, the spleen is too much sweet for the spleen, and the spleen can't transform and transport the fluids. So we start getting some fluid accumulation. We talked about that a few minutes ago. Emotional stress, the liver's heating up, it's causing that depressive heat. Those two get together. Let's get together and have some fun, right? That's where you're getting this damp heat. So you've got the dampness from the spleen and the heat probably from the liver. But infections can also be a form of damp heat, and that can be from an external exogenous force, right? Something coming in and causing us to experience symptoms of damp heat. So damp heat symptoms, red, swollen, or painful areas, often seen in conditions like skin infections. I just had someone today that came in with a skin infection similar to that, or joint inflammation, red, and what they're talking about is red and swollen joints, painful joints. Sometimes you'll see that in rheumatoid arthritis, that kind of stuff. Sticky or greasy feeling, especially on the skin, where you feel like you need some of that skin cleanser to wipe off to freshen up the skin, whatever that stuff is that teenagers get, the skin cleanser, that kind of stuff. Sticky and greasy in the mouth. Yeah, you got something going on if your mouth is feeling sticky and greasy. Yellow thick discharge, such as the mucus phlegm from the nose. Also, when you look at the tongue, you'll see a coating that would be yellow in nature. So that's what they're talking about. And you'll see some of this from infections. I'm sorry, I skipped over a line. But oh, sorry, my brain's gotten in front of what I was trying to say. So yellow thick discharge. So from infections, when you have something that gets really infected, purulent, you'll have discharges that look that way. But then also with damp heat, you'll look at the tongue and you will often see a yellow coating on there. So, but that's what they're talking about. Yellow thick discharges. You get a wound and it's not being taken care of, it'll start to fester and you will get these yellow infection-based discharges. Burning sensations, particularly in the urinary tract or digestive system. So more than likely you have a UTI. Damp heat in the bladder is typically a UTI. And the digestive system, it's like when you poop, and it is feeling like you have a lot of urgency, and you look at the poop and there's yellow quality to it, and that's probably damp heat. Foul smelling breath or body odor. Ooh, you're making a name for yourself. Foul smelling, ooh, and breath or body odor. And that went back to the thing we talked about in the previous, probably in part two of this, is foul smelling breath is the typical thing that you see in a lot of symptom lists for stomach heat. It's very hard to just correct. If you correct, if they have stomach heat and you correct it, that bad breath is a tough one to get rid of. Heavier, sluggish feeling. Once again, that is knocking on the door of dampness. That's a quintessential sign of dampness. That heaviness or sluggish feelings in the limbs or body. We talked about that before. So damp heat. Oh my gosh, more stuff. I told you this dampness goes on and on and on. Digestive issues, including nausea, diarrhea. Sometimes, if the heat's really prevalent, you'll get constipation with a yellow or greasy stool, fever or sensation of heat accompanied by sweating. That's going to be more of your flu symptoms, tuberculosis symptoms. Irritability or restlessness, often linked to the heat affecting the mind, because the liver is involved with generating that heat more than likely. And then we get more irritable because the body is having to try to deal with this dampness and it's making it cranky. We talk about that also in my second lecture series, Who's on What Team. Skin problems such as acne, eczema, redness, and itching. It's just the skin sometimes, it's like we were talking about earlier, it starts becoming greasy, and like with acne, it's like this greasy sheen um, that will that's caused by this dampness and the heat, which is that's what it's called, right? But it's like the dampness is trying to get expressed through the skin, so you start to get this buildup, and then the heat's right on top of it, causing it to be fester and becoming a little more purulent, and you're having these discharges and skin discharges. So the damp heat can have an effect on someone's skin. So I mean, if you have someone that comes in for acne, check out and see if there's any dampness or if there's heat going on, or a combination of the two. Or then also look at, especially if they're a teenager, like hormonally, what could potentially be going on. Because if their diet is really clean, then and they exercise, then and they emotionally are pretty good, then start looking at where they're at hormonally, because hormones can really do a number on people with their face, so, or their just acne in general. Damp heat treatment. Look at your dampness points before. Once again, we're going to see some familiar things. Spleen 9, it's a really good point for clearing dampness. Stomach 40, really good phlegm point. Large intestine 11 is a good heat point. CV3 regulates the bladder and clears the heat from the lower burner. Bladder 22 regulates the sand jowl and helps with fluid metabolism. Spleen 6 strengthens that spleen to help get that dampness out of there. Gallbladder 34, we've talked about that, especially with liver 3, is a nice, those 2 points have a nice synergistic effect, especially if you're getting accumulation in the abdomen, but it helps the flow of liver chi, it helps reduce heat, and helps with that damp heat condition. Ladder 20 is back shoe of the spleen. You're supporting the spleen's function for transformation and transportation to eliminate the dampness. Large intestine 4 combined with liver 3. I don't know if liver 3 was on here before. Well, it should be. I need to make a note of that. Um, especially while I'm saying the liver 3, especially if that heat's being generated by the liver. You want that combination of liver 4, liver 3 to help get that chi stagnation flowing again. So it lessens the heat. But liver 4, large intestine 4 clears heat and helps with general symptoms of heat and dampness because it's part of it. It's sending messages to the large intestine itself to try to dispel some of the dampness. CB12 is another point that's trying to strengthen the spleen, the digestive system. Also, review points for dampness that we talked about prior. They're going to be helpful with this damp heat. Oh my gosh, damp heat again. The areas of the body commonly affected by damp heat include the reproductive tract, UTIs, external genitalia, you get a STD, and once again the urinary tract infection. But the urinary tract can lead right into the reproductive area. So that's where they're talking about that can get affected by damp heat. The digestive system, because you have those, you start seeing symptoms and signs of loose stools, things of that nature. Also, that accumulation just in the digestive tract where the spleen's not functioning optimally, so it's going to start to collect and go sideways. The lower limbs and the skin, you start to get edema in the lower limbs. And this is something that I'd included because I read this somewhere, that patients with damp heat typically, but I'll put not always because not all of my patients that have had damp heat exhibit damp heat in 2 or more places, but it is common. But not everybody. Not everybody. But rarely do they show up in all 3 places, meaning the urogenital system, the digestive system, or the skin system. They don't always show up in all 3 places, but it's not uncommon to have somebody with some digestive and skin issues or some genitalia and skin issues. Just be aware of that. But it's not always the case. Blood stasis. Thank goodness we got out of the phlegm and dampness category. Blood stasis. And I underline this because this is a thing that you will commonly see with people is a key sign or symptom is intense, fixed, piercing, sharp pain that comes at night. If you ask the patient, is this pain worse at night? And is it very focused, very sharp? Then that's probably blood stasis. Another thing is a hematoma or yellowish brown or grayish blue macula, liver spots, aging spots. And don't get thrown off a little bit. Sometimes when you have elderly patients, they'll get on Coumadin or blood thinners, and then they'll bruise up like nobody's business. I mean, that's still a form of blood stasis, but it's not naturally caused. It's caused by that medication. So, find out from them if they're on that medication. Sometimes their skin will get really thin too. I mean, they'll bump into something and their blood's flying everywhere. Those are drugs that if you need them, you need them. But man, they can wreak some havoc on your system. Dark facial complexion, that's a sign that you typically see in the books. I don't know if on patients I see that quite often, but you see that everywhere in the book, so I included that. Dry, scaly, itchy skin, sometimes when you have not the greasy acne skin funk, but when people are talking about I've got skin issues where my skin's dry, um, or flaky, a lot of times you'll see where, at least in books, it'll say, and I'm not discounting what the books say, but they will typically say there's something with the blood. The blood is not getting to the area to nourish the skin, so the skin dries out and becomes scaly. So that's what they say. I'm not saying that there's anything wrong with the book saying that. I'm just saying you see that in books all the time. Um, so, oh gosh, I'm starting to. I need to put another penny in my jar. Sorry. Also, there's this thing that was talking about congested, tortuous, purplish veins. Yes, that's a sign of blood stasis. And I'm not sure, some people are really big into bleeding things. I'm not one of those folks because there's multiple reasons. I mean, it's just messy. And a lot of times people don't like to get bled. But I don't know, even if you have patients that are loving to be bled, I don't think you need to be messing around with these varicose veins. Let the doctors do that. I don't think that. And why I say that is I know I've had many trainings, and I feel like somewhere in the back recesses of my mind, I just don't mess with those. So I guess I don't think about it that frequently, but I feel like when you're in school, they talk about not even you shouldn't do that for certain health reasons, and I can't remember that, and I apologize. I don't, but I guess I don't remember that because I just don't mess with those. I don't needle those, and I don't think you should probably. But do your research on that. But I don't ever do that, and I'm very cautious about bleeding varicose veins. I mean, I know that there's some systems where if somebody has like a little bluish vein, and you can bleed that to help get the blood moving. When you think of like low L, low techniques, my brain's getting tired because it's the end of the day. LUO, low techniques. They talk a lot about bleeding the vessels, and they're not talking about these type of vessels, the big ones. They're talking about just vessels that are a little bluish, showing some stagnation. But this lecture is not even about that technique. I'm just saying for right now, when you're starting out, I wouldn't be bleeding a lot of varicose veins. Causes blood stasis that could be due to chi stagnation. We talked about that a few minutes ago. If the chi is stagnant, the chi leads the blood. If the chi is not moving, the blood's not going to be moving. So either the chi is failing to move the blood, or there may be, and maybe due to a traumatic injury, like somebody's hit somewhere. So the blood gets stagnant, it pools up, including a surgical injury. When things are cut with a scalpel, that can cause coagulation or the blood flow to outside of the channels, which in turn further impedes the flow of the chi, which if the chi is not flowing well because the channels have been cut, then it's not going to be guiding the blood well. So you got that, or body fluids. A lot of times when people have surgery, especially in the lower portions of their body, but it can happen anywhere, the lymph system is cut in those areas. So the movement of fluid is not as optimal anymore. So, and that can take a while. If people have surgery and then suddenly their legs, on their leg, and then suddenly their ankles are swelling. And it just doesn't recover as quickly or as well. And that takes a bit for the body to basically be able to reroute that fluid. So you've got your blood stasis. And remember, if chi is insufficient to move the blood will stop. That's what we were just talking about. Or if the blood is insufficient, it will fail to fill the vessels and maintain a free and smooth flow of blood. So those are two things. Either you don't have enough chi or the chi is not working right and is stagnant and it's not moving the blood, or there's not enough blood to move. So those are the two things to think about when you have blood stasis. Or if you have a traumatic injury, if somebody has a car accident and they've been hit, or it doesn't have to be a car accident. You can be hit by something that can cause traumatic injury, can cause blood to stagnate in that area, pull up. Think of a bruise. So here's some points to look at. Look at blood stasis. So spleen 10, that's a really great point for, it's an interesting point because it doesn't really build blood, but it helps the spleen control blood. So spleen 10, stomach 36, large intestine 4, and bladder 17. Think of the diaphragm again, moving up and down, moving that blood around. Local points on an area, especially if it's a traumatic injury, cupping can help with that too. Oh yeah, there I've got that right there. Cupping areas of stagnation. So both of that. Ashi, that area that's been traumatized, and cup it. And then do these other points. Hallelujah symptoms. What hallelujah symptoms are symptoms that you will see. And, in Chinese medicine, everything is everything and anything can be everything. So it can be confusing. But when you see these symptoms, you know that these symptoms equate to a certain thing. And there's no question about it. So that's why they're hallelujah, hallelujah. So and these are going to be things that you're like, oh, Stacey, I knew that, but it's not like a hallelujah symptom where this is not a slippery slope into something else. This is exactly what it is. So here we go. Let's look at those real quick. Fatigue. We've talked about that earlier. Spleen chi deficiency. If you're especially after you eat, that has something to do with the spleen. Yeah. Yes. I mean, if the person says I never sleep, then maybe they could be fatigued from that. But fatigue typically, especially if you say, "Hey, when you wake up in the morning, do you feel after a good night's sleep, and do you feel fatigued?" Then that is the spleen. Drowsiness after eating, spleen deficiency. Dizziness when standing up, spleen deficiency. Easily bruised or bruising, spleen chi deficiency. Remember that tongue we looked at the very beginning, that big round tongue? Fat, enlarged tongue, spleen deficiency with a little bit of dampness going on. Irritability, frustration, that's liver chi stagnation. Rib side pain, liver chi stagnation, hypochondrial pain. Remember when we were talking about underneath, I'll stand up here, underneath the rib cage here. It's another liver sign. Breast distension and tenderness. A lot of that's liver, especially around PMS time. Depression, chi stagnation, liver. Bowstring pulse, meaning the tight pulse feels like a guitar string, liver. Sign, especially if it's a teenager. Sign, it's a liver chi depression thing. Rapid hungry, stomach heat. If the person's a teenager, because they can eat you out of house and home, might not be a problem because their body's growing and they need a ton of food to basically create building blocks to grow. But if it's a person like me and I'm hungry all the time, stomach ache, night blindness, blood deficiency. We talked about that at the beginning. Choppy pulse. A lot of times when the pulse feels like it's a bamboo, it's a knife going over a bamboo stalk where the bamboo has a little nodules. If you ever looked at bamboo, that's what they're talking about, choppy pulse. Calf cramping in the middle of the night. A lot of times it's liver blood deficiency. I put except in pregnancy, because sometimes in pregnancy, you need to look at the calcium intake of the person. Because if you think about when a person's pregnant, their body is being cannibalized by the unborn infant. I mean, it's using all the resources that the mother has. So sometimes, yes, it can make them blood deficient, but sometimes the calf cramping when someone's pregnant can be uh, nutritional deficiency as well. So just FYI, just a note. Caution. All right, guys. Why I say caution here is what I'm getting ready to present to you is not how Chinese medicine is supposed to be. What do I mean by that? Chinese medicine, what I'm going to show you are a few things that are Western named diseases and then how to treat them, right? But that's not what Chinese medicine is about. Chinese medicine is not about Western named disease equals Chinese medicine treatment, meaning these cookie cutter points. And I'm just showing these to you, and I've got another lecture where I do something do something similar, but I'm just showing these because this is a basic start for you. It's not how you should do Chinese medicine. And if you really just focus on, because it's an easy trap to fall into, trust me, I used to do that when I first started out. It's an easy trap to look for a Western name disease, and then how do you treat it in Chinese medicine? You need to use your patterns to figure out how to treat a person. But when you first start out and you're nervous and you don't know much, then these are some common things that you will see. And the treatments that I give you, you'll understand why you're doing what you're doing. But you really need to know how to figure it out by pattern um, discernment, not, oh, he's got X, that means I need to use this cookie cutter treatment Y. So let's continue because there's just a few things, and it's something that you will commonly see. And when you first get out, like I said, you'll be nervous and you'll be like, I don't know. I really want to know what the best treatment is for this. So these, what I'm going to give you are solid treatments, but they're what you start with, and you need to continue studying so you can figure out how to add to this, how to recognize it without someone saying it's this, and then also recognizing how to treat it. You can do it. You would be able to do it. But like I said at the beginning, it can be confusing. So anyway, let's start up. Anxiety and stress. You will see people coming in all the time with this. I've got a really awesome CEU class that you should check out that deals with the emotions and really, really how to treat them. But for right now, this is a good basis. But 70, gosh, no, it's probably more. I would say almost 90% of your patients will be dealing with stress in some form. They might not recognize it yet. And about 70% of the patients that you have will recognize that stress plays a factor on their health. But a lot more folks deal with stress and anxiety every day. So that's why it's really important to learn a good strategy on how to recognize what type of stress and what type of anxiety they're experiencing and how to treat it appropriately. But right now, like I said, this is going to be a good basic start. So guess what? Stress is nothing other than unfulfilled desires, right? It was what are unfulfilled desires? It's the liver. It's the liver. So when someone is stressed out, I am stressed out because my boss works me too much. Well, what's your unfulfilled desire? I wish I worked less, but that's not happening because I got to work too much. Or the board members on the sidewalk committee won't leave me alone. They just ride me all the time. What's the unfulfilled desire? I wish everybody was a little more copacetic. I wish everything was Wu Wei, was in the middle. So my desires aren't being fulfilled, and I am stressed out. So therefore, stress is nothing more than the subjective experience. I like that. The subjective experience of liver qi stagnation. So what are we going to do? Bam. Liver four. Liver three, large intestine four. That we've talked about that multiple times. It's a really synergistic combination for liver qi stagnation. The liver 4 helps move the energy around. Liver 3 regulates the liver energy. PC6 is good for calming the shin. It's helps get heat away from the heart so the heart can stay cool and relaxed. Yin Tong. Yin Tong's a great point. Everybody loves Yin Tong. It helps calm the mind down. You can joke with them and say, "Oh, look, I'm gonna do the little unicorn horn on you today," and you put it in, and people love it. And always remember, let the yin tong be the first point to take out because that is a common point to bleed on people, and you want to take that out first so you can put direct pressure on there and get it to stop bleeding. And it's not like it's going to take forever, but sometimes it just takes a little bit of a longer period of time. And you don't want to make that the last point and you think, oh, I've stopped the bleeding. And then your patient's sitting over in the chair as you're wrapping up and you see blood coming down their face like something out of a horror movie. And won't be bleeding that bad, trust me. But you just don't want to see it starting to bleed a little bit. So take that one out first so you can make sure that if it's bleeding, that it has stopped. So if they have any blood deficiency symptoms, stomach 36, spleen 6, we've talked about that earlier, good point combo for building blood. If the chest is tight, CV17, right in the chest, that helps open that chest area up as well, SPC6. If the neck and shoulders are tight, which commonly they are with people that are stressed out, you can do GB21, GB20. Those are some good points to just relax the shoulders. You could even like cup the area too. That's helpful. If they're very anxious, you can think about using Heart 7. Or if there's insomnia, you can use Heart 7, Spleen 6. That doesn't necessarily mean that it's going to eradicate the insomnia, but you quite often see that as a point combination in a lot of books for insomnia. Like I said, if they're coming into you for insomnia, you're going to have to work a little harder than just Heart 7 and Spleen 6. You're going to have to work a little bit more than that. But it's a good start. Like I said, this is a good start for this treatment, and people are going to walk away and they're going to be like, oh, I feel really relaxed now. But they'll come back, and this is a good treatment. But like I said, you've really got to explore and figure out why they're getting stressed out to really get it to go away and to help them with that. Depression. We see this a lot too, everywhere. No depression without liver depression. Once again, the star of the show is the liver, right? And then no liver depression in middle-aged Western women, well, middle-aged, Western females without spleen qi deficiency. Because a lot of times, what you'll see, say in other cultures, why I said Western females, because in other cultures, they'll start to try to take herbs and supplements to help build the blood, because as women get older, then they've spent a lifetime of losing blood. So eventually the spleens get weak and can't keep up with the blood that needs to be produced. So they'll start getting some blood production, or not blood production, sorry, blood deficiency symptoms. And when you have blood deficiency, what's blood do? Blood, we've talked about this earlier, it helps keep the liver cool. And when the liver doesn't stay cool, then what happens? We start to see some dips, right? Because the liver's about making the cheese smooth. But when it's not, we start getting some dips in it. We can start feeling a little bummed out, a little depressed. The cheese starts getting low, starts going low, up and down. So what are we going to do? Da, 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 same thing, not the same thing, but very similar. Liver 4. Gosh knows why do I keep saying liver 4? I don't know. Large intestine 4, liver 3. We just talked about the synergy of those 2 points. GV20. At GV20, one of the things that it does is it helps raise the chi. It brings the chi up. So that's one of the reasons that we use that to elevate the mood. Yin Tong. We talked about how that was a good shin calming point. Bladder 18, black shoe of the liver, which helps the liver bring the smoothness of the chi back online. If the chest is oppressed, think about CV17, REN 17 to help open the chest up. If the chi is very stagnant, think about gallbladder 34. Remember, we were talking about that synergy between liver 3 and gallbladder 34? But gallbladder 34 can really help. A lot of times we think about that synergy in the abdominal area, but sometimes we think about the synergy of those 2 points with the gallbladder is like the boss. Remember Punch and Judy before? The puppets, one had the stick. Gallbladder is 34 is kind of like the guy with the stick. He goes around and taps on things saying, hey, you need to do this. So that's what sometimes gallbladder 34 and liver 3 have that synergy of gallbladder 34 making sure the chi is moving around. So it's smooth. It gets more smooth in the body. It levels out. So think about that. If they need vitality, not what we were talking about earlier with the kidney vitality, talking about just energy, feeling energized. Sometimes people, when they're depressed, they'll be like, I have no energy. Then think about stomach 36, spleen 6 to help boost some of that vitality, that energy, to get them to feel more enlivened. Bladder 20 strengthens the spleen. Oops, and then IBS. IBS is something that you'll see quite frequently, especially in our stress-based culture. The main symptoms of IBS: abdominal pain, get some bloating, abdomen feels a little bloated, constipation, diarrhea. But the big one is alternating constipation and diarrhea, especially when they're stressed out. With all these symptoms, especially when they're stressed out. Does your IBS get worse when you're stressed out? Well, how did you know that? Yes. Yes, that is part of IBS. And guess what that is? IBS is Oh, here's some other things before I tell you what it is. Some other things that you will see that will pop up that are complicating factors within this. These were the big ones, especially that alternating constipation and diarrhea. But they'll have some distension, some bloating, some flatulence. They'll get nausea, fatigue. They'll get depressed, anxious, have poor concentration. What does this start to sound like? A little bit of spleen involvement, right? The main cause for IBS is always liver and spleen disharmony, that liver attacking the spleen. So what are we going to do about it? That means, well, what that means is there's liver qi stagnation and there's spleen qi deficiency. Those two things are going on, and the liver is attacking that spleen. Spleen can't hold back, and the defenses are like, oh, I'm too weak. So here's a basic treatment for that. So our old friends, liver 3, large intestine 4, we've already talked about that. Stomach 36, CV12, stomach 25. So the stomach 36, CV12, strengthening that earth phase, stomach 25. It's chipping in, but also is the location is right over the intestines. So it's the front move point of the intestines. So you're kind of getting two birds with one stone, right? Is strengthening the intestinal tract as well as strengthening the digestive functions. Diarrhea, spleen 9. We've talked about that's a good point for dampness. Constipation, we've talked about that. Sand jowl or triple burner 6. Gallbladder 34. Heat, stomach 44. Large intestine 11. And damp heat, we have spleen 9 to help with the dampness, stomach 44 to help with the heat, large intestine 11 to help with the heat, depressive heat, liver 2 and stomach 44. So the fire point of the liver, the fire point of the stomach, spleen deficiency, you're working on that bladder 20 and bladder 21, stomach shu, I know, but it helps further strengthen that earth phase. Kidney yin deficiency, if you see that with the IBS, kidney 6. If you got some yang deficiency, GB4, blood stasis, spleen 10. And da-da! That's it, guys. Hey, thanks for joining me, and I really hope this helps. Like, subscribe, subscribe to the newsletter to get the notes. Like I told you before, I'm not, selling. It's going to sell you like Dr. Diana's self-inflating tires. It's just to give you notifications on when I provide content, classes, and so I can keep track of who's got access to the drive with the files on there. But hey, guys, great seeing you. Thanks for joining me. I've got a few more lectures coming up, and then I've got tons of other stuff, but I've got a few more that were part of the introductory lecture that I listed out in videos that you should really watch. But this is a good one. Like I said, read through the notes once a month when you're in year 3. So when you get to clinic, you will be like, poof, this is all easy. I know exactly what to do. All right, thanks, guys. You can do it. Have a great one.